Remember, after that screenshot of the Nevada State Board of Pharmacy hearing, there are 2 more items in the calendar, huh? Because you might miss that. Okay, let me go back to Blackboard. If I can just show you what I'm talking about, because it's so easy to miss that one. And I want to make sure that you've seen that announcement right here. Let me share my screen right here, right now. Okay, so here it is. This is our schedule, and this is the link. Okay, this is our schedule, and this is the link. It's not a clickable link because it's a picture, okay? So you'll have to type it out. You can join via Zoom using this link or via your phone using this phone number. After that, this is what I'm talking about. It's so easy to miss the September 4th schedule, okay? And then the September 7th, and then the September 8th, okay? Make sure, I should have colored this one to pop out more, but I wasn't able to do that. So make sure you don't miss the September 4th, 7th, and 8th schedule, okay? There's more schedule at the bottom. Okay, what I did, I screenshotted this announcement page so that I have it on my phone. Okay, and then I'm gonna print it on a calendar. I'm gonna slap it on my calendar on my desk, because I missed the physical calendar that I have in the classroom, the big calendar by the month, okay? It's just an extra reminder for me and my meetings. That's why I never miss a meeting, okay? I probably missed one meeting 1 in 10 years where I forgot, okay? Because I forgot to write the schedule, okay? Anyway, you know what's gonna happen in the next couple of days. It's clearly stated in your announcement. So without further ado, let's start off with our drugs. First one would be Composite. Who got Composite? Elizabeth, your turn. Unmute yourself, please.
Okay, my drug was Composite. It affects the nervous system, and the brand name is Composite and also Compro. The generic name is prochlorperazine, and the therapeutic class is an antipsychotic, antiemetic, and I'm gonna blow this, and anxiolytic. The pharmaceutical class is phenothiazine, which is a piperazine derivative. It's used to treat nausea and vomiting, but it can also treat anxiety and schizophrenia. And the DEA class is RX, and the pregnancy class is C. This brand drug is discontinued in the U.S. However, generic versions may still be available. And other things that I found out about it was there was on drugs.com, there was a black box warning saying there's an increase in mortality in elderly patients with dementia-related psychosis. So elderly patients with dementia-related psychosis should not, if they're taking this drug, there's a increase of risk of death. And this drug also may cause anticoagulant side effects, and if you are going to be prescribed this drug, you should tell your doctor about all non-prescriptions, any herbal or vitamin supplements, because there could be drug interaction there. And that's about it.
Good. Okay, bottom line, Composite. Look at this. So the brand name is Composite. That's the most popular brand. The generic is prochlorperazine. Elizabeth, you said something about being discontinued. Which one is discontinued, the brand or the generic?
They said that the brand was discontinued.
But you may found generic available in the market. Okay, so going back, the brand is Composite, the generic is prochlorperazine. The therapeutic class is antipsychotic, antiemetic, and anxiolytic. What's antipsychotic? For psychosis, right? What's antiemetic, Elizabeth? Prevents?
Antiemetic is the nausea and vomiting.
Correct. Antiemetic means it prevents nausea and vomiting. And anxiolytic, what's anxiolytic?
I didn't get a chance to look that up, but I would, if I was to take an educated guess, it might have something to do with I know we talked about this.
Over and over. Break it down. Break down anzio and then lytic.
Oh, it kills cells, if I remember.
Anzio is what? Anzio, A-N-X-I-O.
I'm not sure.
Okay,
But-
anzio came from the word anxiety. Okay, that's the root. Lytic came from the word lysis, which means to kill the anxiety. Remember?
Yes.
Does it
Yeah.
ring a bell now? Okay, to kill the anxiety. The way I remember lysis is Lysol. What's Lysol's slogan? Kills 99.9% of germs, right? So
Yeah.
you have to remember that lysis means kill or kills, and anzio from the word anxiety. Okay, so it kills anxiety. So it's an anti-anxiety drug, antipsychotic, anti-anxiety, anti-emetic. But we most commonly use it for the anti-emetic part to prevent nausea and vomiting. I'd like you to look at the picture. What dosage form is the drug in? Elizabeth, what form is the drug in? Is it a tablet? Is it a capsule?
The drug forms, they come in, the top one is a suppository, and the second one is a pitcher at 10 milligrams.
Correct, okay. But I'd like you to look at the first picture, which is the suppository. If this is an antiemetic, listen to this. If this is an antiemetic and you take it by mouth, what's gonna happen? If the patient is feeling nauseous all the time, the patient is just gonna throw up the drug, right?
Absolutely.
So do you think a suppository is a better form for the antiemetic use of it?
Yes.
Yes, because the suppository has to be inserted in the rectum, into the rectum, okay?
It also says it comes in
Rectal cavity.
injection. Oh,
Go
sorry.
ahead, I'm sorry, Elizabeth, go ahead.
It says it also comes in injection and spanule, S-P-A-N-S-U-L-E.
Spanule, okay, another dosage form. Once you get to your pharmacy lab skills, PHA 225, I talk about spanule. Spanule, S-P-A-N-S-U-L-E, means sprinkle capsules, okay? That's what it means. It's a dosage form. These are capsules you break apart and you sprinkle over food or drinks, okay? That's what spanule means, okay? So I just would like you to notice that the pictures in here, there's a reason why certain drugs come in different dosage forms, right? Because it's not logical to take a drug by mouth if the patient is always vomiting. So did you see that dosage form is suppository? Okay, for other purposes, other uses like antipsychotic and anxiolytic, the tablet may be a good form. Okay,